So one of the things I think that's very encouraging for parents and for community mental health providers and for teachers and counselors is that the quality of our relationships with children is really the foundation. It's the backbone to kids being healthy and resilient, and it's also the safety net for kids who are in trouble. One of the best things that any of us can do is have that ability to share personal care and concern for a child. I work a lot with the public schools. I was a school teacher before I went to medical school, and it doesn't have to be a protracted period of time, but that check-in that you do with each student and that sense of when a child has something additional that they really need to talk about, that sense of a relationship that even though you may not have enough time to fully explore what it is as a major concern for that child, that they trust you enough to say, oh, I think this would be good to talk to the counselor, or can I help you by, can we talk to your parents together about this conflict or problem or feeling that they're having. A lot of children struggle to express their emotions, and it's good to have a good skill set, a good interviewing skill set to follow a child and help them open up. When I work with medical students and residents and even families, I try to help them remember that when a child has feelings to talk about, it's a little bit like having a flower that blossoms. You kind of want to be present. You just kind of have to watch it, maybe encourage it in a little way. But if you really go at it and try to make it open before it's ready, the petals just fall off, and it's not the same thing. So it's important to be able to pace yourself, show interest, understanding, empathy, support for a child, and then they blossom with that type of thing in terms of revealing their inner world and their experiences. The other thing that I would say is having a cohesive group, having parents work with teachers and teachers work with counselors and even mental health professionals, having that all coordinated together, know that they can hand off to each other and support each other's efforts is really key to having a child who really feels protected, supported, and a child who's ready to face the challenges that may come with mental health. Unfortunately, mental health issues are very, very common. One of the things we've learned from studying epidemiology, which is the study of all illness, is if you pile up all the physical illness, it comes from your lungs, your guts, your bones, your hormone-producing organs, that pile is the same size as the pile that is for mental illness. So everyone understands, oh, you got a cold or you have the flu, things happen. We need to be just as warm and empathetic and understanding and interested in helping people with the challenges of brain health, because that pile is just as big. So it's just as common that we're going to have a challenge that occurs within our family. And knowing that it's okay to get help, outcomes are much better. So working together as a team is really key.